Good morning.
Morning.
Hi, everybody.
Good morning.
Good morning. It is muggy out there. I walked to get my coffee this morning, and it was gross. The breeze was nice, but it was muggier than I expected.
Oh, yeah. All my windows were fogged up.
We were outside last night, and my husband was talking about how it was so muggy, and I thought it was so pleasant because I'm from Georgia, and he was like,
right.
"Oh,
right." That's exactly what I was thinking. Yeah.
Hi, John. Thanks for joining this morning.
Hey, John.
Sorry about the commissioner told us on Friday they wanted to meet with us, so I don't know what that means. So that's at 11:30. So
Okay.
I know you had some comments and questions, so I just want to make sure you had time to give them to us.
Awesome. Thank you. I will go ahead and wait to start the meeting until Kevin's on, but we're going to shuffle around a few things on the agenda. We're going to move some to Thursday, and then we're going to start with the school reopening conversation.
Okay. Why is my computer so laggy?
I'm forwarding the command agenda now. You FYI, I see your email.
Thank you.
Did you send it to me last night, Eleanor? Sorry, I was having a little bit of an issue with my emails, and I'm trying to get through them now.
No, yeah, sorry that you were having that email problem.
Sorry.
No, Greg just sends it in the morning.
I will say, though, anybody ever says anything about our IT problem, our ID department, they're lying. We have the best IT department.
That's important. That's good.
Oh, my God. They're so, and this also, every one of them was nicer than the next.
That's awesome.
That is awesome.
Laura, can you mute yourself? Your audio's coming through. Thank you.
Okay, I'll give Kevin another minute.
That's fine. I'm actually. people across the street while we're waiting. So the people
Uh-huh.
across the street, the house was sold, and they have people in. The new owners have carpet guys in to remove the wall-to-wall carpeting that was in the whole house. What a day to be doing this! I mean, it's not hot. At least it's not hot, but the humidity is heavy. So I'm just watching this poor guy haul out these bales of carpet and carpet padding, and it's quite a sight.
Yeah.
Quite a sight. Kind of fun having a window on the world while
Yeah.
I sit here.
Mhm.
Have we heard from Kevin this morning? Is he planning to be here? Do we know?
I
Don't know.
I know I had meant to reach out and see what their emergency was. I hope, but that got lost.
Yeah, well, I was glad that we, he had to leave the meeting previously, and it sounds like everything was okay. There was an
Okay.
emergency situation, but
Okay.
yeah, we don't, I don't know what the latest is. So I would assume he was going to be here today, but just wanted to check that Laura and Jean hadn't heard anything otherwise. I mean, I wanted him to be able to be part of the school conversation.
Right.
Does anybody want to text and see? Because he probably doesn't know. I mean, he wouldn't know that we're planning to have that one first.
Right.
I can do it.
Okay, great. Thank you.
I'm just trying to find.
I guess while we're waiting, I could go through meeting minutes.
Yeah.
So should we go ahead and call the Board of Health meeting to order at 10:08 a.m.?
Hey, sorry, I didn't know I was muted. I'm sorry. It was, I did not hear from Kevin, just so you know.
Oh, okay, thanks. You mean you texted or you hadn't heard anything yet?
No, when you said, had I heard anything, I responded, but I guess I didn't know I was muted, but I did not hear anything from him.
Okay, great. Thank you. So we'll expect him today then.
What minutes do you want to do?
6:11 and 6:22.
I sent my two tiny changes on both on Saturday.
I saw the email, but I couldn't open anything last night, but they fixed me, so I will do it today.
Okay.
I did see it over the weekend. I just couldn't open it.
Okay. Yeah, there were two typos, I think, maybe one typo on each. Oh, right. There's an extra word on the 11th, and then on the 22nd, there was.
You want to tell me now?
It's in, well.
If you
I
already
have
emailed it too, that's fine.
Okay. So we're doing 6:11 now?
Sure. Yeah. So it sounds like
Okay.
Carrie may have emailed some typo. I mean, the only thing I had too was a spelling change, the town council to be COUNSEL.
All right. Tell me where he wrote it, though. Just net.
I think there were a couple of places. I didn't write down the location of those.
So it should be.
COUNSEL.
And how did he spell it?
Oh, the other type of town council, COUNCIL. I remember having a lot of questions about that in the beginning when I started.
I'll just do a search for wherever he put it in and change it.
Oh, great. But I didn't have anything else about 6:11. I don't know if others did. Other than the stuff you emailed.
Yeah, just one. It was I'm sorry, I don't have that email open, but there's an extra word that, the that. I think it was, the sentence said, is the that guidance open or available? And that was my only.
Okay. So I'll go ahead and make a motion to accept the 6/11 meeting minutes as amended with those.
Who's taking notes today, minutes today?
Oh, that is a great point. I can take them.
You're on.
What? Okay, Eleanor notes. Okay.
So I will second your motion to
Okay.
accept the minutes rather.
With Carrie's edits. Paul, a second. Eleanor, roll call. Eleanor, yes.
Paula, yes.
Okay.
Carrie was muted.
Oh.
Thank you, Paula. I just muted myself. Carrie, yes.
Okay, so 6:22 minutes. I had a few more notes about that one. I don't know if it would be easier, Laura, for me to say those changes or to email them. Some of them might require looking back at the video. Do you want, just procedurally, is it better for me to talk through them at the meeting or email?
Morning, Kevin.
Hey, sorry, buddy. I've been trying to get on for like 10 minutes now. I don't know what happened with my technology down here.
Oh, no. Hi, Kevin.
I'm Eleanor. If you want to send it to me, I'm working on the June 8th minutes, and I can add that and get it done and review back the tape if needed. So I'm happy to do that. Keep it simple.
Okay, sure. Okay, so I will send this to you. And with notes. Great. Okay. Well, Kevin, we were waiting for you. We were going to shuffle some things around on the agenda this morning and actually wanted to go ahead and do the school reopening conversation now while John can be part of that call and Gail, because they're going to have to leave early during command.
Okay.
So we can go ahead and
Eleanor?
Yep.
I'm sorry, I don't mean to interrupt, but
Go
just so you know, I believe we do have the tattoo gentleman on the line as well, Mr. Santos.
right. So
Okay, just wanted to make sure you knew, that's all.
yeah, I do see him there, and I see Dan there too. So I had that on the agenda for
That's fine, I
today.
just wanted to make sure. Yep.
No, it's good to, I wanted to clarify. So I'd had that on the agenda for today. Some of this we're going to move to Thursday, I think, procedurally, for the non-COVID related discussion points. We should have those on the agenda 48 hours in advance. So that the meeting agenda can be updated on the town website, can show any non-COVID discussion related items. But I know that the tattoo parlor has submitted this extensive plan for opening as well as for COVID. So, I mean, it could fall under COVID related items. Yeah, Gina, I don't know if you have any more to weigh in about that. I know that we'd had some conversation this morning about the meeting, posting meeting minutes. I mean, sorry, the meeting agendas, posting the meeting agenda.
Yeah. The rule of thumb for the meeting postings, that they're all posted COVID-19.
Mhm.
So the rule of thumb is anything that comes up in advance, like within 48 hours of the actual meeting, like if something were to come up on a Saturday for a Monday, that could easily be added because there was no way you could have posted it if something needs to be discussed by the board. But for things that don't meet that criteria and they're separate from COVID-19, they should be posted on the agenda. So that's really up to the board how they want to enforce that.
Okay. Yeah, I think that makes sense moving forward. I mean, given that we have them on the phone today and that it is COVID related, it seems to me to fall under that umbrella. If that's right. Okay. Well, I guess then the order in which we do this would be dependent on how long we anticipate the tattoo conversation taking. If that can be like a quick 5-minute, and then we can spend the rest of the time talking about schools.
That probably makes the most sense.
Yep.
I think you can probably make a quick conversation.
Yep. Okay. All right. If that makes sense to everyone, then let's go ahead and do that. Okay. So I think everyone should have received, there was a COVID plan, a floor plan, and then a separate attachment that Dan had attached that was questions he had asked and then clarifications that the Mr. Santos had given.
If you guys want to speak, you have to do *6 because I believe you're Daniel and Mr. Santos are muted.
Yep.
Hello.
Hi.
So what was the question?
Oh, we were really just pulling up. So you submitted the benchmark ECP and then a couple of follow-up answers to questions, and then also the floor plan. And it looks like
Yes, ma'am.
Dan has reviewed these and deemed them to be in compliance with all guidance.
I believe so, yes.
Yep, every document that Mr. Santos has sent in is fully in compliance. Even my notes reflect that. There are just some minor variations, but even then, they're all fine.
So what is it that we need to do? I was trying to, I reviewed the documents and they look great, but I was trying to understand the sort of the context of where we are in this process. I know we had heard from, we had approved an initial plan. We had discussion a couple meetings ago, maybe not a couple weeks ago. So I'm wanting to understand is this like step 2 of 5 or where are we?
I can clarify that.
Do this before.
I can clarify this. So according to section 23 of Reading's town ordinances, the floor plan that's submitted by the applicant of a body art establishment needs to be reviewed and approved by the Board of Health specifically, whereas all the other documentation requires approval by its appointed agent.
Got it. Thank you, Dan.
No problem.
And do we have a time frame for the opening of this establishment?
We are slated to open as soon as possible.
They're ready to go.
Okay.
They're going to have their Daniel's going to do their inspection as soon as you're done approving it today, if you approve it.
And did I miss the COVID plan for this? Or is that implicit because it's of all the requirements for the establishment as it is?
I was thinking that the benchmark ECP document that they submitted, I was considering that to be the COVID plan, even though it included a lot of additional information. They did indicate, for example, that I think this was actually called out by Dan, there was no cleaning protocol for some of the PPE, but that was because it was all disposable. So they didn't need an autoclave.
Okay, I was just clarifying basically because I mean, I sort of thought it was implicit just because by the nature of the establishment, but.
And then, Dan, this was reviewed against the sector-specific checklist, the COVID-19 sector-specific checklist, or a separate tattoo parlor set of guidance.
I'm a little lost. The benchmark plan was just their exposure control plan. That's a general plan required for any body art establishment for dealing with any potential infectious disease exposure, not COVID. The adherence to COVID guidelines would be something that I would double check at the inspection stage.
Okay, so personal protective equipment was a term that just coincidentally is also used in non-COVID related tattoo parlor.
Correct.
Okay.
Body art, yes.
Okay.
Because they deal with so many bloodborne pathogens and
Yeah.
they have all their,
Okay.
you feel like nurses, you have everything.
All right. So
That's
this,
right.
this is making more
So.
So it seems then today what we're looking to do is to give approval for the floor plan, and then we would, if the board wants to, and I would advocate in favor of doing this, asking for a COVID plan review that Dan or Laura or whomever does the inspection would then present to the board, and the board could review, and then moving forward, they would be able to do those inspections, the sort of COVID addendum in a similar way that we've done for the civic function permits, where temporarily while we're in a pandemic, long-term temporarily, there's an addendum, to the civic function permits that requires a COVID plan. It makes sense that moving forward with applications of this type, we would also have a COVID plan. And in this case, there's a sector-specific checklist for close contact personal services, which includes tattoo parlors. So my suggestion would be, today we could vote to approve the floor plan, if that's how we so voted. And then the second step would be their submission of a COVID plan.
So Eleanor, the board, I wasn't on the board when a lot of this happened, but the board hasn't reviewed every barbershop and every nail salon and every hair salon's COVID plan, right? I mean, there are criteria, the staff have reviewed it and approved it. Am I correct?
You are correct. This is Laura. You are correct. We have not reviewed them.
Right. So I would think that would be the case here, where we would approve the floor plan, and then we would expect a COVID plan as part of Dan's, inspection. But I'm not sure it has to come back to the board again, because we didn't do it for all those other businesses.
Right. The way that we've done it with other businesses is really through complaint only. So we intended to send out communication to them. I can't remember if we actually wound up sending it out to close contact personal services. I think that we didn't, because of some complications around getting the information in a timely manner. And then we sort of left it to the fact that licensing boards communicate that information to go back to complaint basis only. So we could, so boards of health can ask all of those businesses to submit their plans, and then we could review them. We haven't done that.
Right. So I'm just saying we ought to treat this business like we treated all the others, and if the board hasn't reviewed every plan for all those other establishments, I'm not sure it should exist, and Dan should see it on the inspection, but I'm not sure we have to bring it back to the agenda again. I don't want to delay their opening. That would be my concern, or treating them differently than other persons.
And just to weigh in, if it's a matter of precedent, particularly with regards to businesses that we directly license, for food establishment locations, typically the COVID plan is only something I look for during an inspection, since the state guidelines only require them to have it on hand for review, rather than this being a proactive measure that requires approval by the local board. So assuming that the body art establishment operates the same way that all of our other permitted establishments operate under the purview of the Board of Health and the Department of Public Health, this would be something that would be seen at an inspection and something that would be presented on site at the request of the inspector rather than something that requires pre-approval, at least as far as how we've done it in the past.
Yeah, thank you. Have you done that? Are we doing that? When you go in to inspect, are you also looking at the COVID plan?
Yes, in my food establishment inspections, I've typically presented a COVID plan as the top part. I've added that in.
Great, that's good to know.
Yep.
Okay,
And are we ready for a motion?
sorry?
Are we ready for a motion? Or is there more discussion?
No, I think so. I think that given Dan's clarification that he is looking at the COVID plans, he can share, if it's useful to Mr. Santos, that checklist as a guide to what that COVID plan would look like. But yeah, I think that we're ready for our motion unless there's any other discussion. Did you want to make one?
Who, me? Sure. I move that we accept the ECP and floor plans as outlined by Mr. Santos for his tattoo establishment, pending the inspection and including the COVID protocols.
Second.
Just writing. Okay, Carrie, second. Roll call.
Holly,
Yes.
yes.
Okay. Great. All right. Thank you.
Thank you.
Thanks so much. Take care.
Good luck.
Bye.
All right, schools. So thank you again, Gail and John, for hopping on this morning. So the board discussed this on Thursday night. And then, everyone feel free to jump in. I think our big picture comments were in comparison to the Harvard Public School of Health guidance about school reopening that I think Emmy forwarded to everyone. I think it was around July 17th, which, yeah, right, which has those sort of big categories. And that, we thought that the school plan looked great. There were a couple of categories from the Harvard plan, the building, so air filtration systems, things like that we didn't see in the document you submitted. Maybe you had those plans, we just didn't see them. And then the what I think that document referred to as a healthy policy. So, for example, creating a culture of shared responsibility, promoting testing, that we didn't see described.
So if I could give some context, what you saw was preliminary, which was solely based on what DESE wanted us to submit.
Okay.
What the comprehensive plan is going to be is much more in depth. We're working on a draft right now. It's about a 60-page document. So it's much more in depth than what you saw. It wasn't meant, I sent it out to the community so that the community could start seeing what direction we were heading, but it was not meant to answer all the questions. Just so you know.
Yeah, I think we actually talked about that, John, last Thursday, that this was just a draft that you had out, that you hadn't formalized a final version, what it was going to look like. I think what we also discussed last week was the fact that if you'd like input from the board as you're developing this final draft, we'd be more than happy to give you that input if you so wanted it. So I think there was more. I think what we were looking to do is just to have a collaborative to make, to just make sure that the final document is ready to go when it's ready to go. But it sounds like there are a lot of things still up in the air that you don't even know in regards to what the school is going to look like, start dates and things of that nature. That's not been determined yet, right?
We do have a better understanding today, but in 1 week, we have to have all the answers for DESE, so. and some of this honestly is determined by collective bargaining. So we can put things in a document, but we would need to bargain some of them.
Right. Okay. So as far as the board's concerned, I mean, this is tough to navigate because it's a fluid situation. It sounds like with putting this plan together in place. So would you want us to review and give you some feedback on parts of the draft, or is that valuable or not valuable? Is it better
No,
to wait for a final
feedback,
version?
any feedback is valuable. The draft,
Okay.
hoping will be public. The next draft will be public tomorrow afternoon.
Okay.
So yeah, that would be helpful. But it sounded like you did have some specifics, and I just want to make sure we capture them in this plan.
Yeah, I think
I
we
one of the-
definitely talked about a couple. Yeah.
Yeah, well, I mean, one was, as Eleanor said, was around the environment in terms of HEPA filters or adequate ventilation. You know, in some school districts, like I'm hearing from Boston, that they're struggling with that. Do you see that to be a problem in our buildings? And is that going to be part of the plan to ensure that? Because opening windows is fine, but obviously not during the winter and stuff.
Sure.
Yeah, I was
Oh,
gonna
go
say,
ahead.
John,
Go
I
ahead,
can-
Gail.
So we've spent a lot of time on this. We've looked at, so true disclosure, I'm an accountant, not an environmental engineer. My CPA did not cover this. We have spent a significant amount of time looking at all of our buildings, working with the appropriate folks. We have a very in-depth preventative maintenance program. One of the items, it's sort of interesting because it is a little bit of a mixed bag as far as what level of filter people are suggesting and recommending. So one of the changes we are planning to make is to upgrade to the MERV 13 filter. That in and of itself comes with its own host of potential issues, concerns. It will, which is, it can lead to wear and tear of the machines and the equipment we have, because obviously they may not have been scoped out for that level. We will increase the frequency of changing, because based upon what the filter is, it will require more frequent changing of them based upon what it's doing, which is a good thing that it's a higher level. So we are working on ordering them and placing work orders in to get them installed in all of the buildings. So we started working on that. Again, there's been a lot of discussion as to what the right level is, but we decided based upon a lot of the feedback and concerns we were getting that we would move forward with upgrading the filters from the 8 to the 13th, and then we'll monitor what it does to the equipment we currently have, and if there's any issues or concerns with that. So we have worked through that, which we believe will help alleviate a lot of the questions we've been receiving. The windows, we do, obviously, if the goal would be to open them as much as possible, but again, being the schools, there are limits to how open you can open the windows. It's not like your home where you can open them all the way. Obviously, for various code reasons, we don't have that ability, but we are looking at the air exchanges, the running the equipment longer than we currently are based upon the guidance about having it run earlier in the morning and later in the day. So we are going through all of that guidance,
Great.
if that helps folks.
It's reassuring.
I think the other thing that puts us in a better place than a lot of other communities, our school buildings are much newer. And because of that, our univentilators are much more up to code than in other older buildings. And our older buildings, we have replaced the univentilators as well. So we have a very strong capital maintenance program, which Joe Huggins and Gail lead. And we take good care of all of our equipment, and this is an example of that.
That's reassuring.
I think the only other discussion point that we'd had was around batch testing. We didn't see descriptions again in the document that you sent, which, as you said, was draft and specific to the DESI guidelines. And so I don't think the DESI guidelines asked for as much clarification about.
Don't, and I guess, and I will admit, I sort of, I don't want to say tripped on, I don't live in Reading, but I tripped on the call Thursday night. That's how I sort of knew some of these items. It's what happens when you're stuck at home. You just randomly troll like YouTube videos. So I guess if there's clarification on that, I do want to, at the get-go, say that our nurses are not going to be, my understanding, we have had discussions about this with our nurse, our director of nursing, and our nurses. It's come up on several calls. They are not actually able to perform COVID testing. We are not a clean site by any, that may not be the right word. Again, I apologize, not in the medical profession. We're not able to perform the testing. We're not a test site. So I guess we were looking for a little bit of clarification. I know a lot of colleges and universities, sports teams are requiring it. Again, they're private organizations that can sort of implement some of these. So we were just a little confused as to what it was you were looking for, because I haven't seen any guidance, especially from DESI, mandating testing, and we would not be able to perform it on site.
Yeah, I think the DESI request and guidelines that you followed actually didn't speak very much at all to testing. We were just wondering whether this is very helpful to know that we don't have the capabilities to do it. We don't have, like I said, we can't test for infectious or any other types of, we're not a medical facility. We don't have medical facilities. We have nurse offices to handle it. We do communicate to folks, here are the symptoms to look for. We update it as that list gets updated. We do, obviously for us, even with some of the travel restrictions that have now come out, we are letting our folks know it's 14, you need to quarantine unless you can produce a test. I know there are a lot of different sites that are getting set up, but again, with us not being the experts on those, we can't really mandate where they go and what type of test they would need to get. I think we can just provide the information, and for us, it'll be more of a quarantine period for folks that are exhibiting symptoms, or recommending, again, the guidance changes daily. You call your physician, they may send you for a test, they may not send you for a test. I think that's where we would need to direct them to their family physician, I believe would be the direction we would go.
Yeah, thank you, Gail. That is helpful. And I don't think that we were envisioning mandatory testing.
I wouldn't even want to dip my toe in that pool right now.
Turnaround time would be over before the quarantine,
Right.
We know that the
I think you guys have
commissioner,
a union issue with that as well, don't you?
I think
yes.
we might have a union and potentially a parent issue, because majority of these students are minors that I don't think we can do that to. So I think that was where we just wanted to make sure folks understood why we were doing what we were doing. And DESI has not come out. I think they actually veered away from that. Again, to Kevin's point, there are a lot of potential concerns about mandating.
I think one thing the board can do too, we've talked about making lists of free clinics available to people. I think we could consider putting this just on the COVID webpage that we have up now, so that we're not independently sending it to different people, but have a current up-to-date list of where people can get free tests if that's.
And we can always link to that. Again, I think what we have been directing people to is to work with your family physician. However, because I do know that, I mean, I have heard that sometimes they say wait it out, or sometimes they say go get tested. So I think it's really between the family and their medical plans that they have in place. But if there is a site we can send them to that says, if you want more additional information, I think it might be helpful for us to have that maintained. Because I also don't want to make it sound as if we're proposing or recommending they go to one of these places. I think that's an
Right.
odd position for the schools to be in.
And I'll add, I mean, some testing sites require a referral. Some testing sites require an appointment. Sometimes you can go without a referral, but it depends upon the insurance coverage will vary. If your physician says you need it, then they'll cover it and they won't otherwise. So those are all concerns. The state maintains a interactive web link. It's really nice. That shows all of the testing sites, and when you click on it, it shows the information of, do you need a referral, or is it a drive-through, is it appointment only, and it's quite easy to use. So I think that it would be good to include that link and make that available. There's discussion about testing timelines. It does not have information about how quickly they can get the test results back yet. That's under discussion, whether that can be added. And the state is working very hard to try and decrease the wait time in testing sites in Massachusetts. It's at 70% of the testing sites right now can return results within 2 to 3 days. But that the national labs continue to have significant barriers. So,
And I think I would be I would say, sorry, Carrie, my other question was, we've also received questions as to what tests are acceptable and which ones aren't. Trying to read through the governor's information. There were certain ones that were and weren't. And I think for us, it's just, that's not really our area of expertise. So I would be concerned about us trying to say which tests are to be relied on, which ones aren't. So that's, I think, when you put all of that together, why we would not anticipate having that within the school's plans. I would rather just give them access to a place they could go to look at it, but I think it would be scary for us to tell them what type of test and what type of testing facility they should go to.
Yeah.
No. That would be a physician provider kind of determination. Just as a point of information, I have noticed that some of the clinics that were providing this service are no longer providing it because they have been resourced out of state to the hotspots.
Yep.
So they may be getting a little more difficult to come by.
Yep.
Great. Okay. I mean, not great, good, but thank you.
No.
Yeah. I mean, that's a great point, Paula, because the testing resources as they exist now, just like pandemic conditions and case counts are going to vary, the testing conditions are going to vary. So, you know, what's available, what works can all look very different. So that interactive site, I think, is the best resource. And yes, I think the schools, like knowing your lane. I like that approach. So,
Okay, are there more questions, thoughts, discussion about schools?
Just procedurally, John, how does this work? The school committee's voting this Thursday, and then you send that to Desi.
I'm laughing because
what happens
I don't
after
even
that?
know anymore.
nobody knows.
Kevin, do you have an answer for us?
So I think what's going to happen is that the school committee is going to vote to approve at the policy level the plans and which plan is the preferred plan, which is then submitted by the 10th. In discussions with the chair, we may look at that a little bit differently and push it to Monday, or meet on Thursday and Monday. He wants to see what happens the next couple of days and then make a determination on that. But that's the current plan.
Okay.
School committee does, yes, they do have to eventually vote on this.
Okay. But does DESI ultimately control
No,
regardless? No, it's the school
No,
committee,
it's
right?
local control.
They actually came out
Okay.
last week or the week before and said it's a local jurisdiction decision. So they sort
Okay.
of moved off of the 95% prescribed model they originally started with.
That's the only question I had.
So what I'll do, Eleanor, I'll send it to command tomorrow afternoon, and then if you want to distribute it with the Board of Health, that would be great.
That sounds good. Thank you.
Thank you.
All right, we're here to support in any role you need us, so you just let us
Thank you.
know.
Thank you.
Thank you for all the work. I know you guys have been working very hard.
Unbelievable.
Yes, you guys have been working really hard.
Yeah, I mean, very hard. The word,
Like-
that's not a good word. And it's, yeah.
You put probably
I'm gonna
about 5
write a book.
years
I'm
of
gonna
work
write a
into
book
this,
on this
5
someday.
months.
Great.
Good.
Really?
Rest and relaxed and ready to start a school year new?
Piece of cake. Vacation time, we're taking lots of it, lots of days off.
The part that I feel bad, you're doing all this work, and I feel like within 3 weeks, it's all going to go up in smoke.
Yep.
Yeah, it's
Yeah.
sort of,
That's crossed out
I
now.
hope it doesn't, but I just feel like that's
I
going to
know.
happen.
And I
No,
feel like
I
every
feel-
time we say this, it feels like it was months ago. And I was like, wait, that was just 3 days ago.
Yeah, exactly.
Yes.
I think you guys have been really ahead of the curve in a lot of this, and kudos to you all.
Thank you.
Thank you.
And we appreciate your feedback. We're hopefully, we want this to be an open dialogue. I think some of them, it's just a tricky situation to try to do everything that's going to satisfy every.
It's not going to happen.
Possible.
You're not going to do that.
Yes.
But you've also provided for options so that in some ways you are going to satisfy at least the most number of people. You've got so many options available. I think that's great.
Should be interesting. All right.
Thank you. I don't know if you guys want to stay on, command is in,
Yeah.
we'll be joining in 10 minutes.
I'm gonna jump off because I have a phone call, but I will be back.
I'll stay on until the commissioner's call. I don't know why he has a call.
Okay, then I'll go back to this agenda item number 2, basically updates, discussion points. I just wanted to circle back. Carrie, I'd heard from Jenna and Rec, and she didn't know whether there was she wasn't able to find an order for the flag football, the recategorizing that as high risk. I don't know if you happen to have heard on the DPH call.
Or quickly chat with you coming into today.
Yeah, no, so it wasn't an order, and I just.
Sorry, I'm getting a little feedback. Are other people hearing that?
Yeah. Another conversation, sort of.
Okay, I don't hear it now.
All right. So, flag football, that was, raised on, like Gail says, the days. I think it was last Tuesday. There was, the representative from Energy and
So
Environmental
I
Affairs.
said, I'm sorry, I'm just gonna ramble off a bunch of things. So I
It's
sent
John.
you what I did all weekend.
I'll go take care of it.
Oh, wait. Oh, yeah.
Gail, yeah, I was going to say, Gail, can you text him? Yeah.
Thanks, Gail. Oh, he's mute. Okay. So EEA said on the call, all forms of football are high risk. They did not say that there was going to be clarification of that. They just said all forms of football are. Their document is not an order. It's just the guidance that was released. I did send an email just this morning asking for if there would be any written clarification of that. and that's all I know. So, but they were very clear, because the question actually was posed. It was from the Q&A. It was, is flag football, how do we categorize flag football? And the response was, all forms of football, touch, flag, anything you want to call, are high risk. So I'll see if we get a clarification. But I'm very comfortable that they're very clear that flag football is a form of football and football is high risk.
Okay, great. That reminds me that I'm forwarding you all right now as we speak. I got a note from Bob this morning. Wait, let me just make sure I've got everybody on the email. About a program essentially that SNL has been running in other towns and wanted us to consider running in ours. I don't really know the details of that other than it's 75 minutes of academic support and 75 minutes of physical activity that will be provided to, I think, parents of kids grades 2 through 5. So let me just forward the original email on that, because I think we're going to be discussing it at today's command portion. Okay, and then it's great, Carrie, that
Eleanor,
yeah.
I'm sorry, what towns? Because Wilmington reached out to me and asked if we approve them because they're not.
If I understand your question right, what towns would they be running this proposed event in? They didn't say which towns. It sounded like one town was considering whether they could redo town hall to let the activity move forward. So it may not be a flag football activity. It may just be that SNL football, the organization, would be running a different type of activity. Again, I don't have the details, and so I don't know if they're planning to come in during the command meeting or if we're just going to discuss. I didn't see, as you'll see in the email, there's not a protocol
specific town
in place. Right, there's not a specific town mentioned, and there's not a specific plan mentioned. I think it was just Bob wanted to talk about this inquiry that he had gotten. So you'll see the email that I sent just is from the organizers. But maybe that they're not planning a football event. It's just a physical activity event, but we don't have those details.
Okay.
Yeah.
Okay, thanks.
Yeah.
So there aren't other towns that have approved this model. Is that what I'm understanding, right?
I'm not sure. It says that they were working with other towns who it seems that, and I can go back and read the exact language. My reading of it was that other towns were working with them on this, not saying that they had been approved to move something forward, but that they were in conversations with other towns that may be running it as well, or planning to run it, or thinking about running it. Okay. Sorry, I was just looking at some of the emails that I'd gotten during the meeting to see if we need to talk about any of those. Laura, was there anything, I saw a couple of emails from you just now. Was there anything that you wanted us to bring up?
Those were all forwards from Carrie, mostly about the website and things like that I just hadn't seen over the weekend.
Oh, okay, because you're going through your email now. Okay.
Yeah.
Okay, feel free to jump in and let me know if there's any of that you want to circle back to. For the kid mask distribution, we're going to table that Thursday. It sounds like there might be some logistics that we need to talk about with Bob, so I can have that conversation offline, and then table that discussion either till Thursday or later, pending my conversation with him. The under 40 increasing cases, so that I just wanted to mention and bring up to the board. I think I mentioned it before. So this was something Amy, former Chair Amy Dove, had communicated to me that we're seeing in the state overall increasing cases of children. I think there were two categories, those under 19 and those maybe 20 to 40, which I think she summarized in the letter to the school committee and the letter to the Board of Health that I forwarded you right before this meeting. Emmy was having computer trouble this morning too. So it came in maybe 9:43 or something like that. So just wanted to make the board aware of that and then ask if there were any practices that you would want to put in place if you wanted to. So right now we have, my understanding is that we have one active case in Reading, but that the nurses and Laura and I have talked about letting us know if they start to see any increases. I don't know whether we would want to have that information by age group, if it changes anything. I mean, I imagine that as soon as, for example, if there is a case in a school, that we would be notified immediately. So I'm just sort of bringing it up for discussion. Is there anything, given that information, is there anything that we want to think about now moving forward or actually put in place, such as have demographic information when we see cases? Maybe not. You know, right now we've got the one. So this is maybe just something more to think about as schools reopen.
Doesn't the state provide, or aren't we using the state's plan for demographics in terms of?
No, we decided to, instead of receive that information by demographic categories for the town of Reading, I've on a previous meeting decided just to post to the website the link to information available about the state overall that was broken down by category. Sorry, by county. It was broken down by county and then had that demographic information by county. But in terms of the town of Reading, we don't see right now a demographic breakdown for cases.
Okay.
And so I think, you know, my understanding of what the state is intending is that if and when we would start to see an increase in cases, which again may not happen, the report that Emmy had sent regarding schools opening in different countries indicated that given low community spread and physical distancing, mask wearing, that types of things put in place, there weren't surges in some of these countries when schools reopened. So given that in Reading, the community spread is low, in the larger Middlesex County, it's moderate, we might anticipate that we will also not see a surge. We don't know that. And given that we're not currently receiving any information about ages of the cases, I didn't know whether we wanted to ask for that information. For example, if we see, are we starting to see cases in 10-year-olds or something, might help us make choices about that we would communicate to the school. Of course, it's going to be the school nurses and our public health nurse doing that contact tracing. So,
Right.
I mean, I would anticipate that as soon as there's a case in a school, that the board should be alerted to that. Laura, I don't know if you have thoughts or want to weigh in on whether that makes sense.
Laura's running away screaming at this point.
What?
About
Not at
another
all.
change.
If you just,
No.
no, not, yeah, I know, the changes do drive me insane. But,
Well,
yeah, but if you guys decide and you want to do it, it's as soon as I know and I can do it from the beginning, it makes life easier than trying to go backwards and do it. So if you decide you want to do it at any point in time and you say like on this day, start doing it, that's easy. If you say go backwards and find the dates, that's where it becomes more difficult and time consuming. But really, whatever way you guys want to do it is fine by me. I
Would
can
you
do it
agree
either
that
way.
maybe starting with the start of school, it would be important to have that as a demographic?
I think it would be, if you're asking my opinion, I would, yes. But again, it's totally up to you guys. I can do whichever way you guys want it.
I think it makes sense moving forward, certainly to have that demographic. The question I have is, and just to revisit real quickly, with school opening, we're losing a lot of our contact tracers. I
Right.
know we do have, I think we have both Laura and Elise who are able to do that, correct?
Kristen
The question I have is,
and Elise.
Oh, Kristen and
Kevin.
Elise, okay.
Yeah.
Well, but you're still able to get in there, all right?
Yeah, but I don't
It's
call
Maven.
them. I can't
Okay.
call them.
So it's Kristen and Elise we have doing that. If it's a student, is it going to be the school nurses doing that contact tracing, or is that going to fall on Kristen and Elise? That's the question I have.
Contact tracing is the local board of health responsibility, not the school nurse's responsibility.
Okay,
Right,
so
but
it's
the
going to be
school
Kristen and
nurse-
Elise.
Yeah,
But the school nurses have been assisting in doing the contact tracing. That's why he's saying that.
Right.
Right, and that
I just-
unfortunately ends in mid-August once
Right.
they're back.
Okay.
right.
All
Yeah.
right. So
Oh, they're
that's-
not
I
gonna,
just
they're
wanted
not
to-
gonna do any of it once school starts?
No, nope.
No.
Okay.
No, we had talked
we
about
talked
that early
about that.
on, that they're gonna have their hands pretty much full with their workload in the schools, that we are not
Sure,
able
yeah.
to free them up for this.
Can we should probably reach out to the state then, because we were using the state as a fallback if we got behind on that. I know they just released a lot of those, that staff who was doing the contact tracing for the towns and the municipalities. So just want to make sure we still have that as a fallback, on top
Yeah.
of Kristen and Elise.
Yeah, I mean, I think Kristen, the last time she was on, talked about the contact tracing collaborative as the fallback. And it's my understanding that we could do that the day of, when, if needed. And then that's
You
my-
are correct.
right.
Okay. I know like I
and
said, I know they released a lot of work. I just want to still make sure that that's still up and running. But they released them out of necessity, that they don't need them anymore, but they just want to make sure it's still up and running. That's our fallback.
It's up and running. It's absolutely active. And available. And they did release folks, but they anticipate that they can bring people back fairly readily. Doesn't make sense to be paying folks right now because there's not need, but no thought that needs going away. So
Great. And then I don't know the status of having posted that part-time nursing position. A few months ago, we were considering that would be the best use of the additional salary and the grant funding that we have. So I don't know the status of that position.
That is with HR. One of the things that Laura, maybe you could give an update on Maria's availability, because she has come back and put in some hours.
I have no information on the position that was posted. I don't even know if anyone's applied on that. And Maria can't help with all the COVID cases, like has been going on the whole time. Nothing has changed with Maria. She can't help with the COVID cases. She has helped with questions, maybe like an hour or two a week, just questions if they have a question on how to close something up. Or a couple of weeks ago, I think she put in 2 hours because we had so many cases that had to be closed at Bear Mountain, and there was a lot of questions about that. Just stuff like, she just helps us with questions, and I met with her one week just to do her review, but she can't do any of the contact tracing or anything in Maven because it's just, like she said, it was just too much for her. With running Malden. She's a full-time Malden nurse, and she's on the board in a different town. So she was helping us when our previous nurse would go on vacation or on her days off. She would check Maven to see if there was anything. But, back then it was, ticks or foodborne illnesses. So once Maven got up and running with like all these COVID cases, she couldn't run her town and work on her board and help us as much as she was. So she stopped doing that, but she is still available if we ever have a question. She's an excellent resource, and she's helped everyone on our nursing staff tremendously.
understood. So that's what I was trying to say was, it sounds like she is available as a coach and for technical assistance for you all, but she is not a contact tracing resource.
Correct.
Great. Thanks.
Got it.
That's great to have a coach and have someone who has experience that's readily available, because I know Maven can be tricky for people. So that's wonderful that we have access to that, but it doesn't help you all with the contact tracing piece. So,
But we do have the CTC.
Yep.
All right. Any comments, final comments about that? Okay. I think the only other two items I can just kind of quickly comment on, the gatherings and election safety. I really just wanted to circle back with Laura Jim on that and get any input from the board. Given that we had a question on our last meeting on Thursday about whether or not the plan was to have 240 people max or 100 people max in the building. And so I just need to circle back with Laura Jim about that and Will. And then the only final comment I had was I see that we have everyone on command here. The communicating out about protocols for reopening. But that makes sense to have with everybody on the call. So I think with that, we can turn it over to you, Chief Burns. Oh, we can't hear you.
Thank you. Good morning, everybody. Thanks for having us here today. Again, we have few things to talk about this morning. Wanted to start with our goal 3, demobilization of town departments and the status of policies for town buildings for staffing. Has the board made some more progress on proposed increasing staffing?
I have a question on that. The library is said to return to full hours or staffing. Is that something the Board of Health is reviewing, or by sort of accepting their policy, it's just as long as they operate within those guidelines, you don't need to be consulted?
So I know that we did receive a library protocol previously. Is your question whether or not we need to receive an additional, we're anticipating receiving an additional one before the public?
Just in passing, late last week, Amy noted a change in their operations was either scheduled for this week or next week. I'm really not sure. And I just wasn't sure if that had to go through any channels or had already gone through some channels. I was familiar with the first policy reviewed with you, I want to say maybe 2 weeks or so ago, and didn't know if anything had happened since. And I can obviously ask Amy for more information.
I believe that was that the library is ready to move forward on what we discussed 2 weeks ago. I don't think they were ready to move at that point. That was my understanding of how they were.
Okay, that's helpful.
I mean, and we had left it with my recollection was that we had said, here's the checklist, here's the guidance. This is what should be used in town buildings. If you can't follow it, come back to the board with your addendums and your, explanation of why and questions that you might have. I don't know if other members remember it similarly.
Yes.
No, I remember the same.
Yeah.
Certainly for town hall, I feel that the ball is squarely in my lap. I'm doing
Lucky you.
to ignore it.
Would there be a better way? The part I'm not clear on is whether or not people who are in charge of opening town buildings were made aware of. Should the board be communicating that out to everyone, or how's the best way to make sure everyone knows?
I have a partial department head meeting this afternoon, and it involves department heads that are in other buildings other than town hall. So I can certainly just, throw that out there. I mean, 2 of them are sitting with us right now, so it's really just DPW that may not have heard directly, but I'll make sure that she has. And I'll circle back to the board. My best guess, honestly, is that the board will see this next Monday. I can't really promise this Thursday, but next Monday it should be good. And that's specifically a town hall document. And maybe I'll reorganize some of the other buildings that you'd seen in the past as part of a very large packet, just to skinny it down so you can see what's relevant.
Okay.
And then you can have your feedback on anything you see.
You mean that what we would see on Monday is the checklist and then the addendums?
I probably want to have some sort of a written policy for town hall. I'll leave the other department heads to their own buildings, but I imagine they do too, because some of them already have it.
Mhm.
And that's just what you will have seen: DPW, police, fire as buildings and operations. You've seen a very early draft of town hall, but that was before sort of the guidance that you gave us. So I need to circle back and polish that up. I think only town hall is the outstanding building, and then the senior center is just an unknown at this point. But I think those are the only buildings that sort of need to return to the board that I'm aware of.
Okay, so it sounds like you'll send updated versions of the policies from before?
And I'll just re-include what police, fire, and DPW have already given you, because it was such a large package that was included a few meetings back, that just so you can have it as standalone and it's easier to see. And then if you have any comments on any of that, just share it with us as you can. What we have not yet discussed is how to bring the public back into town hall. And that's something I do want to talk to the board about. But that's best done, I think, after you review some written material from me.
Makes sense.
Okay, so we're not anticipating reviewing checklists and addendums. Just want to be clear about that.
I'm not sure what you mean.
Oh, okay. So on July 20th, we had passed a motion that instead of having everyone submit a protocol that was in alignment with the Needham protocol, we would compromise and come to something that we thought would be easier, which was submitting the Massachusetts checklist, and then any addendums for areas that couldn't really be checked off because of different working conditions or anything like that. Some of the concerns that have been raised previously with the Needham document.
Yeah, okay. Yes, then my answer to your question.
Okay.
Yep.
Sorry for...
No, just wanted to make sure.
I'm glad that we're clear on that. Okay, great.
Yeah, I think to Eleanor's point, we were trying to make this easier for the department, so if they have the checklist, they incorporate that into their plan that they're putting out to their personnel. Not needing to come back to us and say, here's our plan for the personnel.
Right. Okay.
As long as it's meeting that checklist, that
Okay.
we're saying that's sufficient. Now go ahead and distribute it to your personnel as you need to,
Okay.
so they can adhere to it.
Yeah, and it's
So
too
we're
early.
we're just trying to take us out of the equation to make it simpler for the department heads. Does that make sense?
Yeah, it does, and it's a little too early for me to say whether I appreciate your effort, but I don't know if you can entirely take yourselves out of town hall. I don't know that yet.
No,
I may
and
need to
that's
ask
fine.
your advice.
That's
That's
and
fine.
that-
Yep.
And that was what we wanted to do, was
Yeah.
put it into the place of, if there are questions, if these protocols don't work for your building, or you're not sure what it means, then
Okay.
that's what we want to offer for you.
Okay, perfect.
Yeah, and certainly, Bob, if anyone needs the Board of Health's approval, wants it, just from a procedural standpoint, we're happy to obviously look at that. So again, we're trying to make it a little bit easier because there's a lot of moving parts for you all. So we're just trying to give you one centralized place to say, as long as you meet this criteria, you're good to go. If you can't, please let us know and we'll work with you on it.
Okay, that sounds good.
And I just want to, been trying to make the point, need to make the point that the Needham protocol comported with the Massachusetts checklist. So they're the same, it's just a format difference. So that's all. Thanks.
Okay. All right. Anything more on that issue? John, I'm sorry. You wanted to talk about the schools. Did you get a chance to do that?
We did. Gail and I went to the 10 o'clock meeting.
Okay. So I didn't see
Thank
that in time. Sorry about that.
No, that's okay. That's okay.
The next item up, we have on Goal 2 Communications. The Select Board expressed that they had some concerns about being informed about basically the town's response to the COVID-19 crisis, and wanted to discuss the risks and rewards of 3 items. One of the items was rotating a board member through the command meetings. They also discussed the continuity of having one member, as we currently do, that stays with us. And then the third item was receiving written summaries from command. So does anybody want to weigh in on that?
Maybe I can just give you a quick flavor just on top of what you said, Greg. I think that we've been spending a good amount of time at each of the select board meetings getting a summary of what's going on, through command. And even with that, I think some of the board members are feeling that they'd like to be a bit more engaged, if that's the right word, in terms of what's going on, even more so than what we've been doing. And so then the notion came up of, well, should there be a different person that attends meetings? Should we rotate who goes through? Should it be one person that stays with it and a person rotates? Or is there a way to get more of a more complete summary of what has been discussed? So not just kind of the highlights necessarily, but even more information. So I think those are the kind of the 3 items that you mentioned, Greg, in terms of what the board asked, we talk about a little bit in terms of what makes the most sense. The goal is not to disrupt these meetings, but it's very much to make sure that board members are able to feel kind of very engaged on a more regular basis. As the board starts to meet less than every week, which is a nice thing, and command continues to meet weekly, it may be that there's a desire to get more information flowing. So the question was kind of how to do that. And just to be clear, if it's me or whoever is here from the select board, I can't really communicate out to the whole board. Command can communicate to the select board, but I can't.
Yeah, I understand. Do you give briefings at the selectmen's meeting on what's transpired at the command meetings?
At a very highlight level, yes. The Board of Health has had a representative join, and in the past we've dedicated half an hour really to kind of updates. I've been receiving plenty of feedback suggesting that's longer than we should be spending, so I've been trying to kind of shorten that period of time. But by the same token, board members individually are asking for them to be more engaged somehow. Not take a half an hour at the board meeting, but for them to be more engaged. So I think that's the balance we're trying to define.
This is Laura, if I may. Ann Landry is our liaison, correct, still?
Yes.
Correct.
Okay. She's CC'd on every email I send out for the board, if that's helpful at all. Like every time minutes go out, every time there's anything, any correspondence that needs to go out to the entire board, she is on my CC list. So everything I send to the board, she does get. Does that help at all?
So I think it helps in terms of information coming through the health department. It doesn't cover everything that command is spending time on, however.
No.
Yeah, we spend a tremendous amount of time on the issue, both this meeting each week and then during the week. It's just, I know everybody I know, Board of Health spends a lot of time on the issue, and so do I. So I think this meeting is very beneficial for us to get input from the Board of Health, because it's a public health emergency, and their guidance and thoughts and direction is just critical to the overall response. And now it's Eleanor last week reached out to the RCTV. Now we're being covered. So this is on cable TV now. I see RCTV is on today as well. One of the things is I sit on some boards. Reading is in mutual aid group called Metro Fire. It's 35 communities that ring Boston. And I sit on a commission in the state, and every time we have a meeting, I have to report back on what's going on with those commission meetings. And then I take direction from Metro Fire if they have concerns about the commission that I sit on. So it's my responsibility to take that back to them. Does that work with that type of setup work for you, Mark, to present what the discussion is happening at the command meetings, and then to take that information back from the board and present it to us?
So I think as we have board meetings that correspond to a day or two after the command meeting, I think we've been doing that, my perception, between someone from the Board of Health and then either Bob or myself. In a summary fashion, we've been doing that. And it feels the board members, I think we're looking for maybe more of a kind of follow-up by item sort of thing to get a bigger feel for things, rather than just that update. And again, I think we were, dedicating a good 30 minutes to things for a while, longer in some cases. So I'm not sure exactly what they're looking for. I'm happy to allow the person to rotate, so it wouldn't just be me. For other folks that can make time to do that, that's fine. Or if continuity makes sense, to consider having a second member join occasionally, when they can do it. Or the third, I think, is to find some way to get more of following the agenda and feedback on each item. Now, could I, bring some of that back? I can try to do that as an option and see if that works. I think what we'll miss is where we have a meeting every 2 or 3 weeks, then the information is going to get very stale and insufficient. So I'm sorry to kind of foist it on you folks a little bit, but one of the questions was, what would make sense? What allows these meetings to continue to be as efficient as they can be, and find a way to get information to kind of come back to board members?
From my perspective, I asked when this topic came up, I just asked a couple questions, and I'm at somewhat of a loss as to what kind of information the board believes it's not getting, unless it was more of a concern going forward that with, as Mark mentioned, less meeting frequency, which we're all very much in favor of, would create a great gap as opposed to there is one now. I just wasn't sure. I think where the board left it after some discussion was they were leaning towards receiving written summaries, thinking that continuity was probably more important than rotation. I mean, correct me, Mark, but that's what the comments I last heard.
I think that's right.
One member, particularly Greg, likes your weekly comments from the fire department. So even a format that was like bullet points as opposed to a novel, could suffice from command. And we could, for instance, ask Jane or Matt to start joining us and just write up a quick one-page summary at the end. And any of us can circulate that to the select board and not violate open meeting law as soon as, the meeting ends. So that might be one thing to try out.
Yeah, I think that's a good idea, because I think the continuity of having one person having, for example, Mark has been with us for several months, and I think that continuity is important, because if something comes up at Selectmen, you'll know kind of what the backstory was. And if the member changes on a regular basis, they're not going to have that institutional knowledge. So I think it's key to have the same person.
Why don't I just ask Matt or Jane? They already know about this, so that from now on they're always present at a Monday meeting. And as we say, these tapes are available both now from RCTV and Zoom, so they could even write up today's, for instance. Although I guess there's no need because the board meets next week, Mark. So we could just report on this one. But after that, maybe we try this new format.
I think that'd be great. I think the good news is I think members would like to be more engaged. So we're just trying to figure out the best way to do that.
Yeah. Okay. right. Anything more on that particular subject? Okay, we'll jump to the third item, which is goal 4, status of scheduled events in the community. The Board of Health has a public information campaign to encourage mail-in voting, to limit the amount of walk-in people at the field house. And we've had a meeting about that and talked about organizing it and reaching out to the community in various ways, from website to using message boards and possibly using a mailing.
Right. It seemed that so last week there were a flurry of emails about a potential postcard. The sort of last place that we got to was, I think that on Thursday night, maybe Jane had asked for some feedback about a mock-up of a postcard, and then I had emailed about potential approval from command for spending funds to mail the postcard. But our understanding about a timeline was that if we didn't have a draft postcard by today, it wasn't looking like we would be able to mail that out in time. So we didn't receive any approval for that funding request, I guess. And I don't think that we have so I think that the graphic designer didn't move forward. I'm trying to read my emails right now to make sure that I'm up on everything that's just happened. I see one from Jane, but I think that's about postage. So that's kind of where I thought things.
Eleanor, what was the reason for the time frame you just mentioned of today? Was that large M?
No, I think Jean flipped open her calendar and was like, wait, okay, if we need postage to go, if we need a postcard to go out on this date, she was kind of thinking backwards. And then I believe Kevin had worked with the same printer that Jane had recommended, someone in Woburn, and they were anticipating that potentially if we had something to review today or early this week, we might be able to still get out a postcard. But it was a very fast process. I mean, we have been working on a postcard since June, but had really not convened this committee until last Monday. Greg sort of said, here are all the people that I think should be on the committee. And so we met last week, and then just had those last two communications. So Jane trying to contact the graphic designer and the printer, the same or one and the same, and then email about trying to get approval for spending the money that we believe is available, the health fund, health development rotating fund.
Yeah. I just asked about the time frame because we're talking about 4 weeks. There's a lot of things different now, so history isn't always accurate, but you don't want to send a postcard like that too early. If it arrived today, 4 weeks in advance, out it goes. So from a timing standpoint, this is not something you want to be too early on. So I wouldn't be overly concerned about the timing, but I am stepping in at the last minute here, not having been part of it. So it could be things I don't know. It looks like you were close to being ready to go, depending on what the others had said. I made a comment this morning that you saw.
May not have seen. I was trying to read emails while
I just wanted to make sure that people understood it wasn't the town government promoting a recall election. That there wasn't that perception that it was a health-related message.
Right. I think that's something that's really important to make clear. I certainly understand that. That's something that Jane emphasized as well, that I haven't had a chance to talk to board members about, that I had said during this meeting, or maybe I talked to you all last Thursday night, that I could draft and the Board of Health could release a press release indicating that the Board of Health wants to communicate that mail-in voting is what we're encouraging because of the coronavirus and decreasing risk. I think Large M wants to be careful about how we talk about risk of voting and framing things as safe or not. I think there's wording to be worked out about that. And then with the timing of the postcard, our thoughts were, given that the mail-in ballot people have already received their application to receive a mail-in ballot, that it might make sense to follow up with a postcard on the heels of that. So people have, I think it was a week and a half ago that people received their application for the mail-in ballot.
So when we talked last week, we were talking about trying to get a draft and have everything posted with the goal of having it drop on the week of August 16th. And that's what we were driving towards.
The week of August 16th? A draft?
No, for the postcard to drop the week of August 16th.
Yeah, and I think
that was why we were looking for a draft, so that we could authorize and there would be time to print and postage and then get delivered.
Right. And so I think we're awaiting approval from command in order for Jane to communicate with the printer, is my understanding. But again, I've got a couple emails from Jane. I have an email from Jane that I'm reading right now that I think is just about postage. So, so I don't have follow-up from Jane. I think on Thursday night, she sent an email to some members of the committee asking for their feedback about the draft that we had at that time. And I understand you all haven't seen that draft either. I'm trying to think of I feel like I'm doing a lot of talking, but not communicating clearly.
One of the things we talked about at the planning meeting was that cost for that postcard could possibly be reimbursable, but you're never really sure until the whole application goes through. And so we needed to identify where those funds were going to come from to pay for it, because if they weren't approved, then they have to come from somewhere. So and I didn't know they can't come out of the fire department's budget, so I didn't know if there was another line item in the for voting or health related that it could come out of.
Jean, didn't you tell us? Oh, sorry. Yeah.
Yes, that's what I was going to say. Yeah. Health revolving fund, Jean.
The health has their own revolving fund. It's approved by town meeting every year, and it's under the direction of the Board of Health, and Laura is the agent, obviously. And so that fund allows for other projects, kind of wording, in addition to clinics and that kind of thing. So it's a revolving fund that regenerates as a result of flu clinics for the most part. And so there's a very generous balance, and that could easily be tapped.
Okay, so there's the funding source.
No.
So
so all we're waiting on is the actual product. We don't have the finished draft yet. Is that correct, Eleanor?
Right. I think Jane didn't send them the finished draft because we're waiting for approval, is my understanding. Again, I haven't heard from her this morning, and maybe there's more.
Well, I did hear this morning that Laura Gem was still working on the draft.
Ah.
Oh, okay. Okay.
I think it was did you have like 2 sides or something of a postcard?
No. So that's a good point. We had one.
It was 2 images, I remember.
Right. There was Jane came up with a logo that was Safe Voting 2020 and a check mark. I'm not sure. I think I forwarded that to board members. And then the resident, Teddy Asher, had come up with the contents of one side of a postcard that Laura Jim weighed in on to change a couple of terms. For example, she said that special election needed to be referred to for accuracy as recall election, and then that state election could either be, or we could use the terms presidential election, or I think state election, and that she thought more residents would understand presidential election, but that there was an option there. There wasn't an option in the other case.
Okay. Yeah, I assume that you're going to see a final draft soon. I mean, in the next day or so.
Great.
So if you're meeting Thursday, sorry, Carrie.
No, you're fine. It's, I don't like interrupting people. I'm sorry. I have a question. I don't know where the right place to raise this is, but I have a question about content, because do we have to specify the elections, or can we simply say we're promoting voting by mail for
all elections?
For all elections.
That's true. Yeah.
I'm just looking for, can we simplify and avoid any sticky wickets, we'll call them.
Yeah, I think, I'm hearing a lot of good ideas for moving this forward. I wonder whether Board of Health members want to, given that we have a little bit more time, if Jean thinks it's reasonable that we could get this out by August 19th, even if we, for example, take some time this week, maybe Board of Health members could relook at there's a logo and a draft of the postcard, and exactly like you're saying, Carrie, does it make sense to whatever edits anyone has, and then Laura Gem can weigh in on making sure that we're following election guidance for anything. I mean, she's currently looking at that postcard that the resident created, and then we can maybe discuss on Thursday. So while I love Jane's logo, after the fact, I was thinking about it more. The motion that we passed was to encourage mail-in voting, and so safe voting and mail-in voting is a different soundbite. We hadn't had a chance to discuss that.
Yes.
And so maybe we would just revisit this on Thursday, and contingent upon what the printer says, hope that timeliness would still be in effect, that we could still get this out on time.
So I'm happy to review, and it all sounds good. What I'm not clear about is how we tie to command, because I thought this was a command, this needed command authorization.
Right. And feel free to jump in, Greg. My understanding is that any COVID related communications during a state of emergency need to be approved by command.
Yeah, just exactly. So we've put together a structure to respond to the COVID-19 event. So to carry out the board's vote to encourage mail-in voting, we put together a planning team, and the planning team is going to identify how to get that word out. So they're going to develop a plan to do it. Once that's done, planning forwards that to command for review, and then approval or modification, and then once it's approved, then it goes out.
Okay.
And that's the way it works for all the plans. Yeah.
Thank you.
You're welcome.
Yeah. And for this one here, you'd want to use, other than postcard, you want to use social media and other methods as well.
Exactly, right.
And obviously those ones are a little less urgent to get in the queue.
Right.
But, I as part of command, I see no issues with this as long as, my concerns from this morning are addressed, which sounds like they will be. And, even if there wasn't a source of funding, we can always figure that out. Don't tell anyone I said that.
And just to make sure I understand the concern.
Not like you're on TV or anything, Bob. Don't worry.
Exactly.
And the other thing that I left out from that, so command will make sure that logistics gets the material and anything that plan needs, the resources that plan needs to get into place. So if the plan calls for setting up message boards around town, command will make sure that the departments that have message boards get them out in the right locations with the right message on board. So they assign those resources.
Just to make sure I understand too. So are you proposing that by your Thursday meeting, Eleanor, the Board of Health would have all the input, approve it, and then where would it go exactly in order to kind of move ahead from there? What's the next step from there?
I think that it's my understanding that command would approve a final postcard to go out, given that it's a communication coming out during a state of emergency.
So next Monday.
Unless it could be approved over email.
It can be approved via email. Yeah, we've done that in the past with command.
So your goal is going to be to get it out at the end of this week to ideally have the process, have the printer engaged, and off we go.
Yes.
And then also Jane Wellman is looking at social media, what the message would be out on the town's website and also Twitter and different social media platforms as well.
Thank you.
Yep. Okay. Anything more on that particular item? Okay. All right. The next item up, there's a poetry slam scheduled for August 21st, 2020 from 5 p.m. to 7:30 p.m. in the cobblestone parking lot between Town Hall and the Common. And I don't have a lot of information about that. Bob, I know you spoke with or emailed the person.
All I have is really, I guess I didn't actually send you the email. Yeah, it was just a student with a couple of residents involved. Did I send you a filled-in permit? Civic function permit, which isn't commands, it's ours, but I can't remember if I forwarded that.
I think you did.
Okay. I guess the question is, what's command's role? If this were, just to back up a little for everyone's benefit, if this were a group of people or a single person wanting to use the common for any event, a protest, anything, almost anything, they don't need a permit for that. If they want to start erecting structures there that are permanent, that are, not to be taken down right away, for instance, like a plant sale is taken down, then they need approval from the historical commission. The reason this may come to command, as I read through it, was the idea or the desire to link the common with in front of Town Hall and thereby closing off the cobblestones. So that's a logistics decision that requires not only some planning, but if you want it closed at 5 o'clock, it has to be closed a lot sooner than that to make sure there's no cars stuck in there, usually several hours in advance. So I just wanted to bring it to your attention, whether it's handled through command or public safety, beats me. We could do it through PTTF. It's not really a Board of Health issue, but I just thought I'd bring it to this group because you're a broad group. So if you want to refer it to PTTF, I don't know when we next meet, but I'm sure we can handle this in time. And then again, the only concern, which I shared with the organizer, was, again, to pick a Friday night for that area of town is an inconvenience to lose all that parking, but it is what it is. And I couldn't think of any other negative, quote unquote, that was associated with it. That if you can think of any other sort of downside, I did say we'd need to know approximately when they would want to use power. I can't remember if DPW has left the power just turned on now there, but usually they kind of turn it on an appointment basis. And that was the only other logistic I could think of, was shutting down the cobblestone and then the power. Is there anything I'm missing, Greg or Dave?
No, I think you're right, Bob. I think the only concerns are, shutting the parking lot down and that they have power. Last I checked, we left the power on in the common just to make sure it was available and not have to scramble at the last minute to turn on and off.
Yeah, I'll check with Joe this afternoon.
Yeah.
Am I correct? There's a COVID-19 addition to civic function permits now, and that requires a review for outings, right? So that's something Laura sees. Okay, thanks.
Yeah, and I can share the email with everyone who's involved on the checklist. I mean, I could share with all of you, but the organizer had some preliminary thoughts on health and safety, masks and social distancing and so forth.
Yeah, so this is something that we set up that Laura and the chair can approve without the full board.
Right.
That only needs to come before us if they feel there's some things in there that needs to be discussed.
Okay, and I'm not your expert, but I would say there's nothing here that really stood out as being a huge concern to me for what that's worth. It's really just the logistics of the parking and making sure that was safe.
Yeah, Bob, I agree with that. You sent it to me too.
Okay.
25 feet from the audience.
Any special rules on poetry?
No.
Poetry slam kind of doesn't sound passive.
Sounds very aggressive.
Okay, thanks.
And then the next item was John Paul Moran's campaign for U.S. Congress. He's looking to have an event to support public safety on Wednesday, August 5th from approximately 10:30 to 11:15 a.m. And I don't know if he's looking to block anything off. I didn't see any indication of that, but I just got a general email to the effect that the event was planned. Chief Clark, did you have any other information on that?
Chief, I got the same generic email you did, so I actually have no more information other than what you have.
Okay. So I'm not aware they need anything shut down or anything, so.
Yeah, Greg, in the past, this has just been standing on Main Street section of the Common.
Okay. All right, so we'll jump to the next item. There's a proposal to have a after-school program consisting of 75 minutes of academic support and 75 minutes of physical activity. And some of the preliminary details are proposed are using the back parking lot of the Burbank Ice Arena and using their bathrooms, possibly installing a tent there, possibly using the rink during rainy days for ice skating. Their preliminary plan right now is to be outside September and October and then move it inside. And they're also looking at Danis properties. So that's really kind of a synopsis of the information that I saw in an email, but no numbers or anything like that. So it's very, very preliminary and at this point.
Just as a question for Gail, have the schools been involved in this at all?
Sorry, I was multitasking, listening to the commissioner. I am not aware that we have been, but I can double check.
I first heard of it last week, and there's been a couple of emails, and it sounds to me that the assumption is that you don't have full back to school schedule, that there's some either full virtual learning or partial virtual learning for this to make any sense. And I wasn't sure how it overlapped with whatever the school's plans were for, before school, after school, and et cetera.
We're still.
I know you don't know what the future is yet in schools, so.
Yeah, and the challenge is for us to do before or after school should really be tied to what the schools are doing. So to offer something above and beyond what we're doing for the schools, I think is one of the challenges we have right now.
So just to add a little bit more information too. So my understanding is this is SNL Flag Football is the same organization that is hosting this or planning this event. And we've worked with them before on opening. Sorry.
Some districts were.
I don't know if others are hearing some background.
But they're doing another round today.
That's your audio.
We had worked that's my audio. I
think it's Gail. There we go.
Sorry.
Hey, Gail.
So we had worked with them. They were planning on hosting, I think it's Saturday night lights, and we had been working with them, which is an outdoor recreational event, but on multiple fields. So we'd been working with them to scale that back. And then board member Carrie Donnell had found out that recently, I think maybe last Tuesday, all football, whether it was flag football or traditional football, had been categorized as high risk by the state. So the event that they had been hoping to participate in having actual games got scaled back to just having scrimmages. So we've just been working with this organization previously, so we can continue to be in contact with them about following any sort of procedures for youth activity. I don't know exactly what physical activity they were planning, but if it was going to be flag football, for example, that's something that would need to look different than maybe it would have previously, given that that is explicitly categorized as a high-risk sport now, where they would not be allowed to play games, for example. So the board is happy to continue to collaborate with them on that and make sure that we can get to if it makes sense from the school's perspective to be planning this with them, then it would make sense, I think, to have the board continue to be involved to make sure that all the relevant guidance about organized youth sports would follow the COVID guidelines from the state.
Yeah, and I
change weekly.
I have had someone reach out to me about partnering up with them. Again, my concern is I need to be careful that it's not overlapping with when school, either in-person, hybrid, or remote, is supposed to be in session. So I don't have an answer for them because I am a little bit concerned if it runs until, 9 or something in the morning, if students I don't want to say in theory, if students are in school in one fashion or another, that is slightly problematic from a school standpoint. So,
Gail, it would be just easier if you just tell us what Reading schools are going to do next fall. Go ahead.
I think Kevin has an answer for that. Kevin was proposing recommendations earlier. Well, I just heard the commissioner say all the districts that ordered Chromebooks, they're stuck at the border. So he basically said you might need to figure out other technology. So,
oh boy.
I have to ask,
I don't know what border.
I have to ask, where is our modular classrooms?
With the Chromebooks.
Okay, that's what I thought.
Yeah, and I just, sorry, to go back to this proposal, in the email, there's reference to speaking to a Board of Health member, and I was that Board of Health member. I was approached by the organizers and asked in a very theoretical fashion about this, and I said that absent any knowledge, that they would be subject to requirements of gatherings and of safety standards, and that we'd need more information about the activities that were taking place, and that school session times needed to be considered. I provided some very general feedback, which was yes, all of the state guidance would apply, and if that was something that could somehow be worked out, we would review that plan. So I just want to be very transparent about that reference. There was no mention of, yes, this is a great idea, or yes, this will sail through, or anything like that. Yeah, I mean, certainly, I think that what it was presented to me as was this may be a need for families if when, kids are out of school and they need alternative activities. And yes, I think that may be true. So I look forward to knowing what's going to happen with schools when Kevin tells us, and then working through the plan to see if this is something that's feasible. But just wanted to be very transparent.
And I think, Carrie, on top of that, we're still also trying to figure out the rental arena for us as well. So above and beyond extended day, it's when you factor in the number of unknown people coming into the building, the procedures, the cleaning,
absolutely,
all of that. This is, and I'm assuming they want access to the building. So that's why it's not as easy of a discussion, because to open the buildings earlier, keep them open later. And, we basically have no enrichment scheduled in the schools as of right now because of the scheduling and the contact tracing. If we're allowing others in, there's a lot.
Yes.
It was complicated before.
Yes.
Yeah, this is a topic that, it's going to need an enormous amount of discussion unless it's just no.
I like no, but I think
and the real
Kevin offered
question
to
is,
run it.
how much planning can and should we do now when things are uncertain, or do we just wait? I'm happy to reach out and talk to Carl. He's a sensible person, he'll understand. But
And I believe he's trying to fill a need and a gap, so I commend him
yeah, I think he is.
for that.
And
I think we're
he's a creative guy, so.
Yeah. And I think we also have to be careful if it overlaps. Chief Clark won't like this one. We also are trying to figure out our arrival and departure times because we have to space and distance and not let all the kids out of the cars at the same time. So if we throw in a whole new level of another group coming and going, unless we have parachutes, I'm not quite sure how we're going to distance these kids arriving in the morning.
Yeah, we're so used to the complaints down there every single morning. It won't bother us, trust me.
I mean, at some point, schools are going to dominate all of our discussions for a couple of weeks, clearly. So I'll talk to Carl. I'll try to get a better sense of what his unknowns are. And I'll come back to command and suggest how much work we can do in advance that might make sense, if any. I just don't know. But I'll talk to Carl this week.
Just to add, so I was put into copy on the email flow also. One of the discussions was to look at Burbank as the physical location and to potentially have a tent there and use the facilities literally there. So, there's a lot of thinking that's going into it, but I completely appreciate that, we don't know what's going to happen. I think, Bob, if you're talking to Carl, that's probably the kind of, where we are, see what's going on. And maybe there's a way that if things seem to be getting clearer, that there's a path to having the discussion with members of command to get the Board of Health and to get to command. And if it did, in fact, involve a tent, and command, help me here. I'm assuming that then means certainly we know that there are fire regulations, there are public safety regulations, and I think a tent would require select board approval. So that would be another additional activity that would need to take place. So,
yeah, there's one other requirement. Sorry, Mark. A tent is a structure and it requires a building permit. That's something I had mentioned to Carl last week. And also, if there's any electricity, it requires an electrical permit, and I stated that as well. So a tent can present some unique challenges, and we want to make sure it's very, very clear from the beginning that all of these requirements need to be met.
Yeah, I'll try to get from Carl a time frame. I'm sure that from an equipment standpoint, it's not easy to just get a tent, for instance. So I'll try to get a sense of lead time.
With a tent, the size is important because it trips other the larger it is, the more requirements there are, essentially.
Wherever Paul Jackson is right now, his antenna is up.
Yeah. Yeah. Okay.
I'll come back and give you guys an update.
All right. Okay, anything more on that particular item? All right, the last item I have determining residents that need assistance. Jean, have anything from Elder and Human Services?
Just the ongoing protocol that we've been following in terms of checking in and making sure people have what they need. Nothing really new there. I think we were going to talk about the senior van, so I don't know if that's something we're ready for.
So there weren't any requests about the heat?
No, there weren't.
Yeah, that's amazing.
Sorry. Want to jump to the senior van?
Sure.
Okay. I know the Board of Health was going to discuss at the Thursday meeting. Did you get a chance, Eleanor?
We did.
Okay.
So everyone feel free to jump, any board member feel free to jump in too. So we have looked at pictures and protocols from the state and other also education protocols. And our current thinking is that if within the vehicle, passengers could maintain at least 6 feet of distance from the other passengers and from the driver, preferably 10. Oh, look at that. There's a tape measure at the picture. Oh, that's good. So yeah, great. So we were thinking that if that could be guaranteed, and then we had some recommendations about the driver of the vehicle wearing a face shield, just given that the person would be in close contact with, if, for example, providing assistance to someone climbing onto the van. And then let me make sure we didn't have any other. I'm not seeing any other. I mean, everyone wearing masks, and I assume people would register in advance, which would assist with contact tracing. But I think if there aren't other stipulations, that we would be prepared to go ahead and open, to make a motion to, I guess, lift the closing of the senior van. Any other board members remember other qualifications that we thought were important?
The only other thing, Eleanor, if I could jump in, is I know there was some discussion about protecting the van driver and plexiglass and all that. My understanding is there is a plexiglass divider in the van from behind the driver, but anything else that would enclose the driver would present a safety problem, so that would not be recommended.
Okay, well, I think that sounds good, though, if there's a divider between the driver and the passengers.
So I got dumped from that for a little bit, so I missed the discussion.
Yeah, I think we just wanted to, I think it was Rick who had guidance from, I can't remember the authoritative body.
No,
Or was it Carrie?
Carrie had.
Carrie sent it. Okay. Yeah.
Yeah, Mass Elder Affairs or some
Councils on Aging. Yeah, it was the Councils on Aging.
Great. And they had recommended at least 6 feet of distance between passengers and driver. 10 feet, I think, was also thrown around. It doesn't seem like we have space for the 10 feet in these vehicles, but having the windows open, for example, will increase ventilation. Right. It sounds like Jean has confirmed there's plexiglass between the driver and the passengers. And then given the close contact that might need to happen for assisting any passengers actually onto the van, we were recommending that when that interaction happens, if the driver would wear a face shield, and then everyone in the van would be wearing a mask.
Right. In addition to masking. And we had already established that the driver or drivers have been trained in what the cleaning protocol is for vehicles. So that's understood, and that there are 2 vehicles. So that, there's the ability to swap off if need be for cleaning.
Mm-hmm. Thank you.
What is the capacity of the vehicles while maintaining that 6 feet for everybody? Is it basically 3 passengers? Is that the number?
It might be 2, it might be 3. I think there's one 12-person van and one 14-person van, although it sounds like the 14-person is sort of 2 pop-up seats in the back. So I don't know that the van is actually much bigger.
Yeah, they were for wheelchairs.
I think we got 3 or 4. 2 to 4, depending on the seating arrangement and so forth.
Shall we make a motion? Are you all ready? Oh, Carrie? Okay.
Motion to make the senior van available for transportation with COVID protection plans in place.
Second that motion.
Roll call.
Paula, yes.
Carrie, yes.
Eleanor, yes. Great.
Yay.
Accomplishment.
Jean's going to come back with a count of how many times that's been on the agenda for next meeting.
So we could develop a plan that meets these requirements and then put the van into operation, meeting what you have outlined today.
Yes.
Would that?
Yes.
Yeah. I mean, I don't see that we need to review any plan, just that if you can ensure that those things are happening.
Yeah.
That's what we want.
Because the driver would, if there's a wheelchair and that impacts the seating, the driver would know what that is. So he might have to adjust how many people he has because maybe he has a wheelchair person. So.
Yes. Right.
Okay. Okay, good. Very good. All right. That's all that's all that I had. Did anybody else want to bring something up while we're all together? No? Nothing.
How
Okay.
about them Red Sox?
With the recorded crowd sound.
Yeah.
Oh, boy.
Is anyone aware of any planned sort of community events in the next few months that we should be thinking about? I'm not.
So we did get an email from the Rotary about some other version of events in place of the Fall Street Fair. And I asked a lot of questions and haven't heard much back, but that was over the weekend. So maybe people are still catching
They
up.
were thinking of doing an auction down in Jordan's parking lot. Is that the direction they're going?
We got no details, just an email that they wanted to have a meeting or
Satellite event.
Okay.
yeah, something to talk about events, and we haven't heard anything. So they were looking for direction on what the process would be to approve. But I said, without knowing details, it's hard to describe process.
Right. So I shared that the COVID addendum plan, if they went with the civic function, as Jean laid out a lot of different questions that they could answer. And then I sent them the COVID addendum to kind of help shape what they might send to the board. And then I anticipate that they would join a call at some point, but because currently street fairs are not permitted, but it sounds like they were thinking of hosting what they called satellite events. I don't know if that would be maybe 3 smaller events in different locations spread out. I'm not sure.
One other quick item, just to make sure everyone in command is aware, the tent that's at the Main Street parking lot now by the Venetian Moon is scheduled to come down by the 17th of August. The select board took a vote on that. I think it was last week.
All right. Anything else? Well, thank you, everybody. Thanks for having us again.
Thanks for coming.
Okay. All right. We'll see you next week.
Have a good week.
Have a great day.
Have a good day.
Thank you.
Any other Board of Health items?
Remember, if you recall that group that I saw down at Wood End, they were there again last weekend.
So was this the Boy Scouts group?
I only assume that it was. It wasn't as organized as the previous week. There weren't people with shirts on indicating they were in a group. There wasn't signage. There were just a couple of tents and people sitting around there. So it's possible it might have been a private thing, but they were using the field at Wood End, the grounds of Wood End. I don't know if it could have been Boy Scouts, but I wasn't sure.
Right. So, I mean,
I'm itching, I know, but.
Well, I think it's important for us to consider and clarify going forward. I mean, the way that we have enforced COVID guidance up to this point on public fields has been through reviewing protocols that people have to do in order to get approved to use the field. But for private events that either use a field or that use something that's private property, I mean, we still want to make sure that everyone is following COVID guidance.
Right. So, I mean, I debated whether to go up and ask them about it, but
I know.
I know that feeling. Wasn't sure if it was in my purview, so yeah.
So I'm wondering whether this would make sense in connection with with the other agenda items that we're tabling for Thursday. Jean's going to go ahead and update the posted agenda. We could put enforcement back on either for this Thursday or for the next Thursday, which I think this falls under. What are our plans in the cases of both public and private entities or physical spaces that are being used?
Right.
And then I think Laura had texted me back maybe during the last meeting that we can implement fees. We could certainly have the fee structure. For example, we have a current fee structure for other Board of Health policies. We could implement that for this.
Yeah. My recollection was there was going to be some contact with council about that. So that was Laura coming back to us with that.
Yeah, that may have been me who said I would contact town council. I have not reached out. Or maybe I didn't reach out because Laura wrote back and said that we're able to implement those things.
Well, no,
I don't believe I am able to reach out to town council if I remember correctly. Doesn't that go up?
No, I don't think that's what we were saying. I think it was your confirmation does that eliminate the need to ask town council? So, right? That's what I thought we were saying. If Laura says we can do it, then were you saying, Eleanor, maybe we don't have to ask town council?
That's what I was kind of saying. I mean, I think Kevin's question may have been, is anything related to COVID compliance different from other fee structures that we have? Kevin, I don't know if that captures what you were thinking.
No, that's accurate. Yep.
So yeah, so I can either do that or whomever can reach out and tell me. I said I would do it, so I can do it.
Other than the master plan and enforcement, was there anything else that wants to be included on the new posting?
Let me just look back at the.
Okay, anything that's COVID, we're good, but.
Yeah, no, I don't think so.
That's it. Okay. I'll have that done.
Right. I mean, I guess the mail-in voting campaign absolutely falls under COVID. So
yeah,
we're good.
Yep.
Eleanor, when we're talking about that voting postcard, I think I've asked this before, but I don't recall. Are we talking about using first class postage, not bulk rate, so that we get it to be delivered more quickly?
I don't know. I don't know whether the quote that Jane got was for first class or bulk rate. So I can clarify that.
Yeah, there's a big difference between, when it will arrive, given.
Yes.
Yeah.
I don't know what the cost difference is, but it might be worth knowing that.
Yeah.
Yeah.
With the tightness of the time frame.
Absolutely.
I think unless the cost is absolutely exorbitant, even then, I mean, I think it would be warranted. So.
And
one of the things this group,
resources.
one of the things this company does, though, is they will take it and drop it right in, bring it right to Reading.
Yeah, but
so that will speed up the delivery process of getting it out to the residents.
Yep, that helps.
I don't know how much the Reading post office is actually doing in terms of processing mail. It's just that tiny little operation out of the Eastern Bank, so I don't know what.
Yeah, I thought it had to go through Woburn. I thought everything had to go through Woburn as a distribution site.
Oh,
That's
okay.
probably another piece of information that would be helpful to have.
That would be, because we want them to drop it wherever they're going to do the
Yeah,
voting.
I hate to have it come to Reading only to have to be then
Go
sort,
back
you
to
know,
Woburn.
somehow get enough delay getting it over to Woburn.
Yep.
Yeah, that'd be good, useful information.
Yep.
If you called them, Conley probably knows it off the top of their head, the answer to that question. So
So
send
they
an email
do.
or call
Yeah.
them.
Do you know the name of the place? Oh, actually, Jane sent a link. Never mind. It was
Connolly.
Connolly. Yep.
Yeah.
Okay. Any other thoughts, comments? No?
Lunchtime.
I think this was a good day's work.
Agreed.
It's always a good day's work.
It's
Anybody want to make a
So-
motion? Oh,
I was just gonna say that. I move to adjourn.
second.
roll call.
Yes, says Paula.
Carrie says yes.
Yes. All right. Take
All
right.
care, everybody.
See y'all later.
Thursday.
Thank
Bye.
you, everybody. Have a
Bye.
good week.